Good morning, everyone. I'm Representative Patty Bellock, and I'm here today with Senator Dale Ryder. And we have spent about the last 4 years working on the issue of Medicaid reform in Illinois. So after yesterday's State of the State address by the governor, we wanted to touch on some of the issues that we feel are really important that we have already done in the last year, because last year was a record year in working in a bipartisan fashion, as most of you know, on the Medicaid reforms. We passed a major bill in January, and again we passed another major bill in June of last year addressing the Medicaid reforms. And that was with a bipartisan vote by both Democrats and Republicans in full force, and applauded by Governor Quinn last year. So just a couple of those things that we feel strongly about are the income eligibility issue and the residency issue. We did the recapture audit, which we felt would save the state close to $1 billion alone on that issue. And we did the end, which the Auditor General recommended, an end to the passive redetermination, which we felt is a way that people stay on the rolls and never come off the rolls. And the major issue was integrated coordinated care, which I will say the director has moved forward on the integrated coordinated care, but also one of the major things, the top priority, was to have a moratorium on new and moving forward on the programs that we had, no expansion of those programs. So those were the major issues. There were several others. There was probably 18 if you looked at both of those bills. So we today want to embellish on that right now because we felt that the governor just touched on those issues, and we think that those bills passed and that they should be implemented by the administration. And we have seen a lack of implementation of those reforms to this date. We've had several discussions with the administration on this. We have pushed for those reforms, the implementation of them, and recently, just in December, we voted through another bill giving them either 12 or 19 more people to hire because they said that that was one of the problems why they couldn't implement the reforms. This year alone, as you know from the Civic Federation and from our projections, we are going to have $2.5 billion worth of Medicaid bills in May that will be unpayable. In another year, that'll be $5.2 billion. Those are just the Medicaid bills. Those are not the other bills of the state. So these are the issues that we're trying to address because those are all taxpayer money, and those are providers that will not be getting paid unless we address this right now. Those are your hospitals, your nursing homes, your doctors, your social service agencies. All of those people will be pushed back if new additions are made to the programs that the governor addressed yesterday. So I'll let Senator Ryder speak to this issue too. Thank you.
Good morning. Thank you everyone for being here. My name is Dale Ryder. I'm the Deputy Republican Leader in the Illinois Senate. And since I was elected to the Senate in 2003, the Medicaid issue has become one that I've tried to focus on to a significant degree. Let's talk a little bit about where we were a year ago, when there seemed to be a bipartisan recognition among Democrats and Republicans and the governor's office that the Medicaid program was drowning, that the backlog of bills was getting too high. In fact, this year, as Representative Bellock talked about, the backlog of bills is predicted to be 5 times what it was 10 years ago. This program has been out of control. But last year, in a surprising moment of bipartisanship, Democrats and Republicans recognized together that the taxpayers are at stake, and we have to save the Medicaid program for the people who truly need it. And so, as Representative Bellock talked about, we passed reform legislation that included 3 very common sense initiatives. These are the kinds of things that people back home and say, wow, I can't even believe you have to pass a law to do that. One, to make sure that people live in the state before they access taxpayer benefits through the Medicaid program. 2, that we make sure that they actually make the amount of money that they can make and be eligible for the program, to keep people who don't belong on the program off the program. And 3, while we're catching up on this backlog of bills, while we're trying to save the program for the people who really need it, let's stop expanding the program because we're just too far behind on our bills now. That was a year ago. Now, those initiatives, those 3 I listed right there, 2 of those, require us to request the federal government to allow us to change the Medicaid program through what's called a waiver request. A year later, a waiver request for the income verification has not been filed. A waiver request for the residency requirement has not been filed. But what we found out 3 days ago is that In an effort to expand the program, the Quinn administration has decided to file an expedited waiver request to add 100,000 more people to the Medicaid program in Cook County. So when the governor mentions the word reform twice yesterday in his speech, apparently what the governor is talking about is growing the program, despite a year ago his embracing the legislation that passed that said we were not going to expand the program. There was discussion last year before that bill passed of whether or not we should provide an exemption in that moratorium for Cook County. That was rejected. That was rejected by all the lawmakers in this process. In the end, there are two fundamental issues here. One, is this state going to have a Medicaid program that's designed for the people who truly need it, for the indigent and the disabled? And two, whether or not we are going to be able to go forward and seriously reform the program to save it, or whether or not we're going to continue to go down the road that this administration and the Democrat Party has gone down, not just for the last 3 years, but the last decade, in saying, oh yeah, we're for reform. We're for the taxpayers, but in the meantime, we're going to continue to grow the program beyond what the taxpayers can afford. We cannot go down that road any further, and that's why we are here to say, stop the process of trying to expand the program and get to work on the reforms that the General Assembly and the governor said they were for a year ago. Making sure people live in this state before they can spend the taxpayers' money, making sure that they don't make any more than what the program allows to be on the program, and stop expanding the program for the next 2 years. I'd be happy to answer any questions, as will Representative Bellock.
Dale, I thought that there had been a waiver file that was rejected, and they just didn't push for it.
No, there was not a waiver. The director of the Department of Health Care and Family Services, and we get you a copy of the letter, sent a letter to the federal government saying, you know what, we know you guys are probably going to deny this, but gee, we thought we'd send this letter anyway. That's not an effort to get a waiver. That's almost an apologetic way of saying, you know, the General Assembly said that we would do these things, so I want to send you some paperwork and see what you think.